So Sam, thanks for coming today.
Yep.
How are you doing today?
I'm doing great.
Excellent, excellent. And I know that the last time we talked, we sort of been planning on doing a relapse prevention plan.
Yes.
And so I see you invited your mom, Beth. So a part of relapse prevention, Sam, is of course involving sometimes family members in helping identify certain components of maybe what happens before and during an episode. Sometimes during episodes of psychosis, the individual is not always aware of what's happening. And it can be flooded with some very intense emotional experiences and thoughts and feelings. And so it's often very important to have a family member present if possible. I just wanted to check it out. I know that you invited her today, but are you still comfortable with her being here today?
Yes.
With us? Excellent. Okay. So let's talk a little bit about, just because you and I have talked some about what relapse prevention is, but relapse prevention is a sort of a psychosocial education type intervention that involves really planning for the worst in some ways, and then hoping for the best is one way to put it. And so if we look at early intervention, when we first met, right when you were discharged from the hospital, at that time we were really looking at you sort of getting stabilized and feeling comfortable. And so how are you feeling now about that, as far as now compared to at that time?
I think now I'm feeling, like you said, a lot more stable. I think now would be a better time to put something like this in place than when I was still suffering from some of the side effects of psychosis.
Sure. Okay. And so when we look at how do we define a relapse, it's different for everybody. And so often, I ask the individual, how would you define a relapse, Sam?
A relapse to me would just be falling back into another bit of psychosis.
Okay. I'm also going to ask your mom how she might define a relapse, just so we're kind of clear. Her definition may be the same, may be different. And so, Beth, from your perspective, what would you consider what would a relapse look like?
I think a relapse to me would be when I see him acting different than his normal behavior, either his emotions or his eating habits, or even changes in the way text messages look.